Hello everyone, so thank you for joining me today, and today we're going to be looking at how to get the most out of hospital placements. I remember when I started hospital placements in my third year, I found it very daunting, so I've made this video hopefully to make the process a little bit easier for you and to reassure you and also to help you hit the ground running. So just a little bit about the medicine guide. I've made quite a few videos now in this series focusing about how to be successful during the pre-clinical years at medical school, how to be successful during the clinical years at medical school, how to get the most out of your GP placements, and how to succeed in your clinical OSCEs. So if you like the video that I've made today, if you've enjoyed my previous videos, then please give me a thumbs up. Please subscribe to my YouTube channel. Please post in the comment section about anything that you enjoy the video, anything that you think I could do better in, and also please share this video with your friends. So without much further ado, I'm going to be discussing how you can get the most out of your ward placements, clinic placements, and also when you've got the opportunity to visit theatre and see surgery being performed. So starting off with ward placements, so it's really important that you try to find opportunities to assist the healthcare staff, and by that I mean take opportunities to practice venipuncture, ABGs, cannulas, catheterization and performing an ECG. So these are all routine jobs that need doing on the ward, and if you're there, then it's a brilliant opportunity for you to freshen up on your skills and keep practicing your clinical skills, which puts you in a better position when you're approaching your OSCEs. And also it means that you're helping the healthcare staff and they'll be more willing to take time out for you and to give you a little bit extra teaching and to help guide you if you're unsure of anything, if you're doing little jobs for them such as this. So really it's a two-way winning street, so I would recommend that you find opportunities as often as you can and as much as you can. And also find opportunities to consolidate your own learning. So I do appreciate that sounds a little bit ambiguous. By that I really mean present chest x-rays, present abdominal x-rays, present ECGs. So if you're talking to the doctor and you see that he has an ECG in his hand, or perhaps you've taken a history of a patient and you're presenting the history back to doctor, and this patient also happens to have a chest x-ray or an abdominal x-ray that was performed, if you present it back to the doctor, then it helps you in terms of improving your own confidence at interpreting different types of imaging, but it also helps you to improve your confidence, so you will come across far more slicker later on down the line when you have most definitely an OSCE station where you're assessed on how you can A, interpret a piece of imaging, and B, how well can you present that piece of imaging to other people, because those are two different skills. But if you take opportunities to practice as often as you can on wards, then that will help you put you in a better position later on down the line. Okay, so perfect history taking skills, and I think it's really important that when you ask the doctor for advice on which patients to perform an examination on, I think it would be better if you approach the doctor and ask him or her if you could see a patient who has clinical signs, because in the clinical years in your OSCE you will have a patient who has clinical signs of heart failure, clinical signs of COPD, clinical signs of aortic regurgitation murmur. So if you're unfamiliar with what these signs are, and if you've never performed an examination on an abnormal patient, then you will miss out on those signs, and that could ultimately cause you to score poorly in the OSCE, and this is a situation which is easily avoidable. So if you take the opportunity to practice examinations on as many abnormal patients, then it will be far more easier for you later on down the line to identify the pathological signs in patients to hopefully get you a better score in your OSCE. Okay, so those are my top tips for ward placements. So how to get the most out of clinical placements. So this is when on your timetable it might mention that you are due to attend endocrine clinic, for instance, on a Tuesday afternoon. So this would be the best way of approaching a situation like that. So contact the consultant secretary in advance. So a few days leading up to clinic, just ring the consultant's secretary, because you would have been told which consultant's clinic you will be attending. So contact their secretary and just clarify with them if the clinic is going ahead, because I've been in situations where placements such as this has been cancelled at last minute, and for whatever reason it wasn't communicated back to me. So it's always important to confirm that clinic is still going ahead. And secondly, ask the secretary if the doctor has a subspeciality within that area. So clarify if it's going to be a general gynecology clinic, for instance, that's happening on the Friday afternoon, or does the consultant subspecialise within that field? So will it be a general gynecology clinic, or will the clinic actually be focusing on seeing patients who are presenting with prolapses, because that will be a very different experience to a general gynae clinic where women might be referred in because they're experiencing abdominal pain for prolonged periods of time. So it's really important that you identify exactly if the placement is going to be happening, and two, what type of clinic is running, just so you can brush up and read up on that topic beforehand. So I've covered this point anyway, but it's important that you try to read up on the common conditions beforehand, because most doctors will expect you to have undertaken some degree of background reading prior to entering their clinic. And again, seek opportunities to consolidate your own knowledge. So in clinic, I'm sure there will be imaging that is used, or the doctor will refer back to previous imaging that the patient has undertaken. So again, ask the doctor if you could kindly present the chest x-ray or the abdominal x-ray that's been performed, and present the findings back to them. It's again practice to help you get better later on down the line, when you will undoubtedly have to present a chest x-ray or an abdominal x-ray during your OSCE. Again, if you're offered the opportunity to perform a clinical examination on a patient, take that opportunity. You have a doctor who's going to be observing you, and they will give you constructive feedback, and that is invaluable. Also, if you're given the opportunity to undertake a patient history, again, that's amazing, because what will probably happen is that you'll take the history, you'll feedback to the doctor, you'll present your history back to the doctor, and she'll give you, or he will give you constructive feedback. And that's really, really important, not only in terms of helping you become a little bit more slicker in your approach to things, but also in terms of helping you develop your own confidence. So when you are approaching your OSCEs, you'll be able to approach it with a smile on your face. Okay, so now looking into theatre placements. So this is when it mentions on your timetable that you're due to attend theatre on, let's say, Monday morning, and you're a little bit anxious, you're not really sure what to do. So firstly, a few days before you're due to attend theatre, please go to theatre, speak to the gentleman or the lady that's working behind the desk, and ask them for that particular surgeon's theatre list, because it will state on that theatre list that surgeon X is operating on Monday morning and they will be performing the following surgeries. So you need to know the name of the surgeries that are going to be happening on Monday morning, because you need to read up on those surgeries beforehand, because that's something that every surgeon will expect you to do. They'll expect you to be familiar with the surgery that they're performing. Okay, so refresh your anatomy. Again, it depends on what type of surgery is being performed. So if you're going to see, for instance, a vascular surgery, then it's important that you're familiar with vascular anatomy rather than neuroanatomy. Does that make sense? So you've got to freshen up on the type of anatomy that's relevant to the operation that will be happening. So like I said again, so research the type of surgery that's being performed. So what they will expect you to be familiar with is the indications for the surgery, and also the complications. So what are the immediate complications of performing the surgery, and what are the long-term complications of performing that particular operation. Again, seek opportunities to consolidate your own learning. So if the surgeon is willing and is happy for you to do this, they may give you the opportunity to perform suturing, and that is an invaluable experience. You may not get the experience to perform suturing again. And also cannula insertion is something that you'll need to be quite comfortable with, and catheterization is also very important. So again, I hope you can see that there are opportunities for you to practice your clinical skills. It just comes down to chance sometimes when these opportunities do present themselves. Okay, so these are references, but the message that I want to leave you with today is believe you can, and you're halfway there. So like I said, it can be due to chance. Not everybody is lucky 100% of the time, so that's why it's important to seize the day and seize as many opportunities as you can do, and practice as many clinical examinations, clinical skills, practice history taking, because this will all help to make you come across as more confident and more polished. So when you approach your OSCEs in the summer or in the winter, if you've got winter OSCEs, then you'll be able to do so with confidence and a smile on your face. So if you've enjoyed my video today, and if you've enjoyed my previous videos, then please give me a thumbs up. Please subscribe to the Medicine Guide YouTube channel. Please share with your friends, and also post in the comment section below anything that you like or anything that you don't like and you wish me to improve on further. So thank you for watching today, and I hope that you will enjoy your hospital placement, and I wish you all the best.